What is a heart attack? A heart attack happens when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Coronary artery disease, CAD, is the main cause of heart attack. A less common cause is a severe spasm, or sudden contraction, of a coronary artery that can stop blood flow to the heart muscle. A heart attack happens when something blocks the blood flow to your heart so it can't get the oxygen it needs. Heart attacks are also called myocardial infarctions, MI. Myo means muscle, cardial refers to the heart, and infarction means death of tissue because of a lack of blood supply. This tissue death can cause lasting damage to your heart muscle. Your heart muscle needs oxygen to survive. A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. This happens because coronary arteries that supply the heart muscle with blood flow can become narrowed. It is due to the buildup of fat, cholesterol and other substances that together are called plaque. This slow process is known as atherosclerosis. When plaque within a heart artery breaks, a blood clot forms around the plaque. This blood clot can block the blood flow through the artery to the heart muscle. Ischemia results when the heart muscle is starved for oxygen and nutrients. When damage or death of part of the heart muscle occurs as a result of ischemia, it's called a heart attack, or myocardial infarction, MI. About every 40 seconds, someone in the United States has a heart attack. Why didn't I have any warning? The process of atherosclerosis has no symptoms. When a coronary artery narrows and constricts blood flow, other nearby blood vessels that serve the heart sometimes expand to compensate. This may explain why there are no warning signs. Such a network of expanded nearby blood vessels is called collateral circulation. It helps protect some people from heart attacks by delivering needed blood to the heart. Collateral circulation can also develop after a heart attack to help the heart muscle recover. Is my heart permanently damaged? When a heart attack occurs, the heart muscle that has lost blood supply begins to suffer injury. The amount of damage to the heart muscle depends on the size of the area supplied by the blocked artery and the time between injury and treatment. Heart muscle damaged by a heart attack heals by forming scar tissue. It usually takes several weeks for your heart muscle to heal. The length of time depends on the extent of your injury and your own rate of healing. The heart is a very tough organ. Even though a part of it may have been severely injured, the rest of the heart keeps working. But, because of the damage, your heart may be weakened, and unable to pump as much blood as usual. With proper treatment and lifestyle changes after a heart attack, further damage can be limited or prevented. Will I recover from my heart attack? The answer is most likely yes. The heart muscle begins to heal soon after a heart attack. It usually takes about 8 weeks to heal. Scar tissue may form in the damaged area, and that scar tissue does not contract or pump as well as healthy muscle tissue. As a consequence, the extent of damage to the heart muscle can impact how well the heart pumps blood throughout the body. How much pumping function is lost depends on the size and location of the scar tissue. Most heart attack survivors have some degree of coronary artery disease, CAD. They will have to make important lifestyle changes and possibly take medication to prevent a future heart attack. Taking these steps can help you lead a full, productive life. What are the symptoms of heart attack? Symptoms of a heart attack include discomfort, pressure, heaviness, tightness, squeezing, or pain in your chest or arm or below your breastbone. Discomfort that goes into your back, jaw, throat, or arm. Fullness, indigestion, or a choking feeling, it may feel like heartburn. Sweating, upset stomach, vomiting, or dizziness. Severe weakness, anxiety, fatigue, or shortness of breath. Fast or uneven heartbeat. Symptoms can be different from person to person or from one heart attack to another. Women are more likely to have these heart attack symptoms. Unusual fatigue, shortness of breath, nausea or vomiting, dizziness or lightheadedness. Discomfort in your gut. It may feel like indigestion. Discomfort in the neck, shoulder, or upper back. With some heart attacks, you won't notice any symptoms, a silent myocardial infarction. This is more common in people who have diabetes. Is all chest pain a heart attack? No. One very common type of chest pain is called angina. It's a recurring discomfort that usually lasts only a few minutes. Angina occurs when your heart muscle doesn't get the blood supply and oxygen that it needs. Angina pectoris. The difference between angina and a heart attack is that angina attacks don't permanently damage the heart muscle. There are different types of angina, including stable angina or angina pectoris. Stable angina often occurs during exercise or emotional stress when your heart rate and blood pressure increase, and your heart muscle needs more oxygen. Unstable angina, sometimes referred to as acute coronary syndrome. Unstable angina occurs while you may be resting or sleeping, or with little physical exertion. It comes as a surprise. Unstable angina can lead to a heart attack and it should be treated as an emergency. What are the different medical terms for a heart attack? Acute coronary syndrome, ACS, an umbrella term for situations where the blood supplied to the heart muscle is suddenly blocked. STEMI, a common name for ST elevation myocardial infarction, a type of heart attack caused by a complete blockage in the coronary artery. NSTEMI, a non-ST elevated myocardial infarction, a type of heart attack in which an artery is partially blocked and severely reduces blood flow. Myocardial infarction, MI, the damaging or death of an area of the heart muscle, myocardium, resulting from a blocked blood supply to that area. It's also the medical term for a heart attack. Coronary thrombosis, formation of a clot in one of the arteries that supply blood to the heart muscle, also called coronary occlusion. Coronary occlusion, an obstruction of a coronary artery that hinders blood flow to some part of the heart muscle. Coronary occlusion is a cause of heart attack. Are there other causes of heart attack besides blockage? Sometimes a coronary artery temporarily contracts or goes into spasm. When this happens, the artery narrows, and blood flow to part of the heart muscle decreases or stops. The causes of spasms are unclear. A spasm can occur in normal-appearing blood vessels as well as in vessels partly blocked by atherosclerosis. A severe spasm can cause a heart attack. Another rare cause of heart attack is spontaneous coronary artery dissection, which is a spontaneous tearing of the coronary artery wall. How is a heart attack different from cardiac arrest? People often use these terms to mean the same thing, but they describe different events. A heart attack is when blood flow to the heart is blocked. It's a circulation problem. With sudden cardiac arrest, SCA, the heart malfunctions and suddenly stops beating unexpectedly. Sudden cardiac arrest is an electrical problem. A heart attack can cause a cardiac arrest. In cardiac arrest, also called sudden cardiac death or SCD, death results when the heart suddenly stops working properly. This is caused by irregular heart rhythms called arrhythmias. Ventricular fibrillation. The most common arrhythmia in cardiac arrest is ventricular fibrillation. This is when the heart's lower chambers suddenly start beating chaotically and don't pump blood. Death occurs within minutes after the heart stops. Cardiac arrest may be reversed if CPR, cardiopulmonary resuscitation, is performed and a defibrillator is used within minutes to shock the heart and restore a normal heart rhythm. What causes a heart attack? The vast majority of heart attacks occur because of a blockage in one of the blood vessels that supply your heart. This most often happens because of plaque, a sticky substance that can build up on the insides of your arteries. It is similar to how pouring grease down your kitchen sink can clog your home plumbing. That buildup is called atherosclerosis. Sometimes, plaque deposits inside the coronary, heart, arteries can break open or rupture, and a blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood and cause a heart attack. Heart attacks are possible without a blockage, but this is rare and only accounts for about 5% of all heart attacks. This kind of heart attack can occur for the following reasons. Spasm of the artery. Your blood vessels have a muscle lining that allows them to become wider or narrower as needed. Those muscles can sometimes twitch or spasm, cutting off blood flow to heart muscle. Rare medical conditions. An example of this would be any disease that causes unusual narrowing of blood vessels. Trauma. This includes tears or ruptures in the coronary arteries. obstruction that came from elsewhere in the body, a blood clot or air bubble, embolism, that gets trapped in a coronary artery. Electrolyte imbalances, having too much or too little of key minerals like potassium in your blood can cause a heart attack. Eating disorders, over time, an eating disorder can cause damage to your heart and ultimately result in a heart attack. Is acute coronary syndrome the same as a heart attack? Acute coronary syndrome is a life-threatening condition that requires emergency medical care and can result in a heart attack. Acute coronary syndrome is a name given to 3 types of coronary artery disease associated with a sudden rupture of plaque inside the coronary artery. Unstable angina, ST segment elevation, myocardial infarction or heart attack, STEMI. Non-ST segment elevation, myocardial infarction or heart attack, STEMI. The location of the blockage, the length of time that blood flow is blocked and the amount of damage that occurs determine the type of acute coronary syndrome. Risk factors for heart attack. Certain factors contribute to the unwanted buildup of fatty deposits, atherosclerosis, that narrows arteries throughout your body. Risk factors. You can improve or eliminate many of these risk factors to reduce your chances of having a first or another heart attack. Heart attack risk factors include 1. Age. Men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger men and women. 2. Tobacco. This includes smoking and long-term exposure to secondhand smoke. 3. High blood pressure. Over time, high blood pressure can damage arteries that lead to your heart. High blood pressure that occurs with other conditions, such as obesity, high cholesterol or diabetes, increases your risk even more. 4. High blood cholesterol or triglyceride levels. A high level of low-density lipoprotein, LDL, cholesterol, bad cholesterol, is most likely to narrow arteries. A high level of triglycerides, a type of blood fat related to your diet, also increases your risk of a heart attack. However, a high level of high-density lipoprotein, HDL, cholesterol, good cholesterol, may lower your risk. 5. Obesity. Obesity is linked with high blood cholesterol levels, high triglyceride levels, high blood pressure and diabetes. Losing just 10% of your body weight can lower this risk. 6. Diabetes. Not producing enough of a hormone secreted by your pancreas, insulin, or not responding to insulin properly. It causes your body's blood sugar levels to rise, increasing your risk of a heart attack. 7. Metabolic syndrome. This syndrome occurs when you have obesity, high blood pressure and high blood sugar. Having metabolic syndrome makes you twice as likely to develop heart disease than if you don't have it. 8. Family history of heart attacks. If your siblings, parents or grandparents have had early heart attacks, by age 55 for males and by age 65 for females, then you too might be at increased risk. 9. Lack of physical activity. Being inactive contributes to high blood cholesterol levels and obesity. People who exercise regularly have better heart health, including lower blood pressure. 10. Stress. You might respond to stress in ways that can increase your risk of a heart attack. 11. Illicit drug use. Using stimulant drugs, such as cocaine or amphetamines, can trigger a spasm of your coronary arteries that can cause a heart attack. 12. A history of preeclampsia. This condition causes high blood pressure during pregnancy and increases the lifetime risk of heart disease. 13. An autoimmune condition. Having a condition such as rheumatoid arthritis or lupus can increase your risk of a heart attack. Complications of heart attack. Complications are often related to the damage done to your heart during a heart attack, which can lead to abnormal heart rhythms, arrhythmias. Electrical short circuits can develop, resulting in abnormal heart rhythms, some of which can be serious, and may lead to death. Heart failure. A heart attack might damage so much heart tissue that the remaining heart muscle can't pump enough blood out of your heart. Heart failure can be temporary, or it can be a chronic condition resulting from extensive and permanent damage to your heart. Sudden cardiac arrest. Without warning, your heart stops due to an electrical disturbance that causes an abnormal heart rhythm, arrhythmia. Heart attacks increase the risk of sudden cardiac arrest, which can cause death without immediate treatment. Prevention of heart attack. It's never too late to take steps to prevent a heart attack, even if you've already had one. Here are ways to prevent a heart attack. Medications. Taking medications can reduce your risk of a subsequent heart attack and help your damaged heart function better. Continue to take what your doctor prescribes, and ask your doctor how often you need to be monitored. Lifestyle factors. You know the drill. Maintain a healthy weight with a healthy diet, don't smoke, exercise regularly, manage stress, and control conditions that can lead to a heart attack, such as high blood pressure, high cholesterol and diabetes. Tests to diagnose a heart attack. Your doctor may order tests including EKG, also known as an electrocardiogram or ECG. This is a simple test that records the electrical activity of the heart. It can tell how much your heart muscle has been damaged and where. It can also monitor your heart rate and rhythm. Blood tests. Several blood tests, often done every 4 to 8 hours, can help diagnose a heart attack and spot any ongoing heart damage. Different levels of cardiac enzymes in your blood can indicate heart muscle damage. These enzymes are usually inside the cells of your heart. When those cells are injured, their contents, including the enzymes, spill into your bloodstream. By measuring the levels of these enzymes, your doctor can find out the size of the heart attack and when it started. Tests can also measure troponin levels. Troponins are proteins inside heart cells that are released when the cells are damaged by the lack of blood supply to your heart. Echocardiography. In this ultrasound test, sound waves are bounced off your heart to create images. It can be used during and after a heart attack to learn how your heart is pumping and what areas aren't pumping the way they should. The echo can also tell whether any parts of your heart, valves, septum, etc., have been injured in the heart attack. Cardiac catheterization. You might need cardiac catheterization, also called cardiac cath, during the first hours of a heart attack if medications aren't helping the ischemia or symptoms. The cardiac cath can give an image of the blocked artery and help your doctor decide on a treatment. In this procedure, a catheter, a thin, hollow tube, is inserted into a blood vessel in your groin or wrist and threaded up to your heart. Dye is used to highlight your heart's arteries. Your doctor can then identify blockages, which are often treated with angioplasty or stents to open the artery and restore blood flow. Your doctor may do several tests to assess your heart. Intravenous blood thinner is an option to open the artery if cardiac catheterization is not available. Stress testing. Your doctor can do a treadmill test or a radionuclide scan to check whether other areas of the heart are still at risk for another heart attack. Heart attack treatment. A heart attack is a medical emergency that needs immediate care to prevent permanent heart damage or death. Treatment often begins in the ambulance, or in the emergency room if someone else took you to the hospital. What drugs are used to treat a heart attack? At the emergency facility or hospital, you'll quickly get drugs to prevent further blood clotting in the heart and ease the strain on the heart. Drug therapy aims to break up or prevent blood clots, stop platelets from collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. You should get these medications as soon as possible, within 1 or 2 hours from the start of your heart attack, if possible, to limit heart damage. Drugs used during a heart attack may include aspirin to stop blood clotting that may make the heart attack worse. Other antiplatelet drugs, such as clopidogrel, Plavix, Prasugrel, Effient, or ticagrelor, Brilinta, to stop clotting. Thrombolytic therapy, clot busters, to dissolve blood clots in your heart's arteries. Any combination of these. Other drugs given during or after a heart attack help your heart work better, widen your blood vessels, lower your pain, and help you avoid life-threatening heart rhythms. Are there other treatments for a heart attack? Treatment may also include a procedure to open the blocked arteries. Cardiac catheterization. In addition to making a picture of your arteries, cardiac cath can be used for procedures, such as angiography or stent, to open narrowed or blocked arteries. Balloon angioplasty. This treatment can be done, if needed, during cardiac catheterization. A balloon-tipped catheter, thin, hollow tube, is inserted into the blocked artery in the heart. The balloon is inflated gently to press plaque outward against the walls of the artery, to open the artery and improve blood flow. Most of the time, this is not done without putting in a stent. Stent placement. In this procedure, a small tube is inserted through a catheter into a blocked artery to prop it open. The stent is usually made of metal and is permanent. It can also be made of a material that your body absorbs over time. Some stents have medicine that helps keep the artery from getting blocked again. Bypass surgery. You might have bypass surgery in the days after a heart attack to restore the blood supply to your heart. Your surgeon will reroute blood flow around your blocked artery, usually using a blood vessel from your leg or chest. They can bypass multiple arteries. What happens in the coronary care unit, CCU? If you've had a heart attack, you'll usually stay in a CCU for at least 24 to 36 hours. Once past the critical phase, you'll continue to get a variety of drugs, including beta blockers to slow the heart, nitrates to increase heart blood flow, blood thinners such as aspirin, Brilinta, clopidogrel, Effient, heparin, or Plavix to prevent further clotting, ACE inhibitors to help the heart muscle heal, statins, cholesterol-lowering drugs such as atorvastatin and simvastatin, to help the heart muscle heal and lower the risk of another heart attack. While you're in the hospital, medical staff will constantly monitor your heart by EKG in case you develop unusual heart rhythms. Some people may need to be fitted with a pacemaker, a battery-powered device to help keep a steady heart rhythm. If you have a dangerous arrhythmia known as ventricular fibrillation, medical providers will give an electric shock to your chest. Treatments don't cure coronary artery disease. You can still have another heart attack, but you can take steps to make it less likely.